through GPs in England and in care homes in Scotland. And day by day, we're giving hope to more people and making this country safer. It's life-saving work. However, it will take time for its benefits to be felt far and wide. So we must persevere, because the virus remains just as dangerous as it has always been. The average daily hospital admissions are up 13%. The latest figures show that the average daily cases have risen by 14% in the last week. And as before, this rise and this spread is not even across the country. We're seeing a sharp rise in South Wales, in London, and parts of the east and southeast of England. This is a trend we're also seeing in other parts of Europe, in countries like Sweden, where nearly all the intensive care beds in Stockholm are currently in use, and Germany, where they've had to announce tougher new restrictions over the weekend, and the Netherlands, who today have announced further measures. Until we can vaccinate enough vulnerable people and ensure they get the second dose so that they're protected, we must act to suppress this virus. Our strategy throughout, as set out in the winter plan, has been to suppress the virus while protecting the economy, education and the NHS until the vaccine can make us safe. And today, Mr. Speaker, I'd like to update the House on the latest steps we're taking on this mission. First, I'd like to update the House on a new development about the virus itself. Over the last few days, thanks to our world-class genomic capability in the UK, we have identified a new variant of coronavirus, which may be associated with the faster spread in the southeast of England. Initial analysis suggests that this variant is growing faster than the existing variants. We've currently identified over 1,000 cases with this variant, predominantly in the south of England, although cases have been identified in nearly 60 different local authority areas, and numbers are increasing rapidly. Similar variants have been identified in other countries over the last few months. We've notified the World Health Organization about this new variant, and Public Health England is working hard to continue its expert analysis at Porton Down. Mr. Speaker, I must stress at this point that there is currently nothing to suggest that this variant is more likely to cause serious disease, and the latest clinical advice is that it's highly unlikely that this mutation would fail to respond to a vaccine. But it shows we've got to be vigilant and follow the rules, and everyone needs to take personal responsibility not to spread this virus. Mr. Speaker, the first formal review of tiering decisions is taking place this Wednesday, 2 weeks after the new rules came into force. However, I need to tell the House that over the last week, we've seen very sharp exponential rises in the virus across London, Kent, parts of Essex and Hertfordshire. We do not know the extent to which this is because of the new variant, but no matter its cause, we have to take swift and decisive action, which unfortunately is absolutely essential to control this deadly disease while the vaccine is rolled out. In some parts of these areas, the doubling time is around every 7 days. This isn't just about rising rates among school-aged children anymore, but in all age groups, including the over 60s. And we know from painful experience that more cases lead to more hospitalizations and, sadly, the loss of more of our loved ones. Hospitals across the capital, Essex and Kent, are already under pressure, and we know that this doubling of cases will be mirrored in hospital admissions, and it only takes a few doublings for the NHS to be overwhelmed. Our NHS is straining every sinew to cope with the pressures, as they always do, but if cases continue to double, even they will be overwhelmed. So we must act now to shift the curve, because when the virus is growing exponentially, there is not a moment to spare. We're therefore acting ahead of the formal review date. I'm very grateful to colleagues at Public Health England, NHS Test and Trace and the Joint Biosecurity Centre, whose surveillance of this virus means that we can act very rapidly when a problem arises. We've therefore decided to move Greater London, the south and west of Essex, which includes Basildon, Brentwood, Harlow, Epping Forest, Castle Point, Rochford, Malden, Braintree and Chelmsford, along with Thurrock and Southend-on-Sea borough councils, and the south of Hertfordshire, which means Broxbourne, Hertsmere, Watford and the Three Rivers Local Authority, into Tier 3, which is the very high alert level. This means that people can only see friends and family they don't live with or are in a support bubble with in outdoor public places and, of course, in line with the rule of 6. Hospitality settings must close except takeaway and delivery, and people should avoid travelling outside their area and reduce the number of journeys they make wherever possible. Now, I know that this is difficult news, and I know that it will mean plans disrupted, and that for businesses affected, it will be a significant blow. But this action is absolutely essential, not just to keep people safe, but because we've seen early action can help prevent more damaging and longer-lasting problems later. Mr. Speaker, these restrictions will come into force at midnight on Wednesday morning, because when the virus moves quickly, we must move quickly too, and we must take the actions that are not necessarily easy, but are effective. We'll continue to stand with those who are most impacted through our furlough scheme and support for the self-employed. We've already begun to surge mobile testing into these parts of London, Essex and Kent, and we're extending community testing too. In addition, I can tell the House that this weekend, as part of our expansion of community testing, we're extending it to 67 local authorities across England, and further, today we'll be publishing a guide for colleagues to promote, support and champion local community testing and contact tracing. We'll be using millions of newly invented tests to reduce the rate of infection in areas where infection is highest and help to move down through tiers and closer to normal life. Mr. Speaker, thanks to the forces of science, help is on its way. But while we know now that that day will come, this isn't over yet. And while we deploy the fruits of scientific endeavour to make the country safe, we must do what it takes to protect our loved ones and our NHS now. I know these steps are hard, but we must not waver as we enter the final stretch, so that when we look back on this time of crisis, we can all say that we played our part. And I commend this statement to the House.
We now come to Shadow Secretary of State Jonathan Ashworth.
Grateful, Mr. Speaker, and as always, grateful to the State for advance side of his statement. This is a virus that, without adequate restrictions in place, spreads with ferocity. And case rates are increasing again, hospital admissions climbing, they are edging up. Last week, the England-wide rate was 159 per 100,000. Now it's 188 per 100,000. That's a 20% increase. Across London, cases have increased 30%. Across the east of England, 36%. So none of us are surprised at the action he is taking today. Indeed, he was warned that Tier 2 wouldn't be enough to contain the spread of the virus in many places. And indeed, it looks like in some areas, such as Kent, Tier 3 isn't enough to contain the spread either. Elsewhere in the country, Tier 3 does appear to be allowing the virus, forcing the virus to flatline, and indeed the northwest is trending down. But overall, the increasing areas are rising faster than the decreasing areas are falling. And as things stand, we are heading into the Christmas easing with diminishing headroom. The buffer zone these tiers were supposed to provide is getting much thinner. So what is his plan to keep people safe through Christmas and avoid huge pressures on the NHS in January? What is his plan to support an exhausted, underfunded, understaffed NHS through January to deliver the care patients will need? And is he confident that our NHS won't be so overwhelmed in January that it impacts the vaccination programme? Now, our response throughout to COVID could have been stronger had contact tracing been more effective. In boroughs like Islington, only 65% traced by the national system. In Tower Hamlets, only 60%. In Barking, 61%. And yet test and trace is costing 22 billion, more than the policing and fire service budgets combined. And yet, according to the NAO, up to September, only 785 million was allocated to local council public health teams. Meanwhile, Serco have subcontracted to 21 other firms, offering little training to staff, with some in call centres, alongside others making sales calls for gambling websites. Surely it's time to scrap Serco and put all public health teams in the lead in doing the retrospective cluster-busting contact tracing we need. Now, he has promised more testing for Tier 3 areas. What about the Tier 2 areas? And on the lateral flow tests he is rolling out, he will know that some care home providers are refusing to use these because they're concerned about their accuracy. So is he satisfied that these tests are accurate enough for this purpose and are safe? And if they can't be used for care homes, how quickly can care home residents' relatives make use of PCR tests? Now, he often praises Liverpool, but isn't the biggest lesson to draw from Liverpool that people still struggle to isolate if they haven't got the financial means to do so? The eligibility criteria for the £500 payment is still too tightly drawn. People need decent sick pay. People in some circumstances need alternative accommodation. People need help with the shopping and the medicines. Surely some of the 22 billion spent on test and trace could be reallocated to offer people adequate isolation support. Now, on the variant that has been identified, our constituents will be naturally concerned. Will he undertake to keep the House updated throughout? And I'm grateful for the briefings that he has arranged for myself and others with the Chief Medical Officer. But if this variation means the virus is more easily transmissible, then fixing contact tracing and isolation becomes even more fiercely urgent. Now, finally, Mr. Speaker, today I spoke to Fred Banning. Fred is just 38. He has 2 children under 10, and he has terminal cancer. He asks that those with terminal illness are given quicker access to the vaccine, so he can, in the words that he said to me this morning, make the most of the time he has left with his family. I understand these are clinical decisions, but could he, through his offices, look into access to the vaccine for those with terminal illness and see what can be done for people like Fred and many others in this situation?
Secretary of State.
Thank you very much, Mr. Speaker. Well, I'm glad to say that across large parts of the country, there is very good evidence that Tier 3 restrictions are working and the rates are coming down. But we do need to be vigilant. And as he knows, overall, rates are no longer coming down, and hence we're having to take further action. And in particular, he talks about the lessons from Liverpool. I think the primary lesson from Liverpool is that when everybody pulls together and everybody makes the sacrifices that are necessary for their whole community, you can really get this thing under control. And I'm grateful to colleagues across London and Essex and Hertfordshire who I've been talking to today, who are committed to working to ensure that we get the public health messages out first and foremost, and to the Mayor and the Conservative candidate for Mayor, who are all committed to working on behalf of the capital and, of course, those parts of Essex and Kent and Hertfordshire that are affected, because the single best thing that we can all do is speak with one voice about what's needed to get this under control. He asked about Christmas, and my recommendation to people at Christmas is to be cautious and careful. He asked about NHS funding and staffing. Of course, we have the strongest funding in history for the NHS, and I'm delighted to say that we have more nurses in the NHS than ever before. 14,000 more nurses than this time last year, and I pay tribute to each and every one of them. He asked about contact tracing, and no doubt he will have seen the figures published on Thursday, which show that contact tracing now reaches over 80% of contacts, and I pay tribute to the team, both local and national, who are ensuring that we can get to more than 4/5 of people who we need to reach, and that has been rapidly improving. He also finally asks about Fred, the gentleman with terminal cancer who he spoke to this morning. What I'd say is that those with terminal cancer, of course, are clinically vulnerable by their nature, and by the nature of that awful disease. And we will ensure that those who are clinically vulnerable do get access to the vaccine when it is clinically appropriate. I'm very happy to take up the individual case that he raises and ensure that he gets a fair deal. But all in all, Mr. Speaker, I'm grateful for the Honourable Gentleman's support for the measures that we've outlined today, and of course support for the vaccine programme, which is rolling out across the country right now.
We now come to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. These are incredibly difficult decisions, but I wholly support them because the evidence from all over the world is that in these situations, acting early and decisively is the best way to save both lives and jobs. And so close to rolling out the vaccine, it would be perverse in the extreme if we were to take our foot off the pedal. But can I ask him about this new strain first of all. He said it's highly unlikely that the vaccine won't work with the new strain. When will we know for sure? Are there any trials going on? Is he going to get more up-to-date scientific information on this anytime soon? And secondly, can I ask him for clarity? Just 11 days before Christmas, lots of people will be thinking about Christmas shopping. From Wednesday, if you live outside London, will it be against the regulations to come into Oxford Street to do your Christmas shopping? If you live inside London, will it be against the regulations to do your Christmas shopping? And is the only way to do your Christmas shopping legally now to go online?
Thank you very much, Mr. Speaker. Firstly, his point about the new variant, that is being assessed. The question he asked is being assessed in Porton right now. But as I said in my statement, the medical advice that we have is that it is highly unlikely that this new variant will impinge the vaccine and the impact of the vaccine. But we will know that in the coming days and weeks as the vaccine is as the new strand is cultured at Porton Down, and then, of course, the tests conducted upon it. The question he asks about Christmas shopping is important. It is recommended that people should minimise travel unless it's necessary in a Tier 3 area, and should minimise travel where it's necessary to a Tier 3 area. And so we have taken this action to try to protect people and to try to slow the spread of this virus. And that is absolutely the right thing to do.
Let's head up to Scotland to SNP spokesperson Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. Many public health experts have questioned the use of intravenous lateral flow tests for mass community testing,